technique anymore. I'm not afraid to come here. For me, that's a huge step. That's a huge step.
Tell us about the evening after your first visit.
I don't remember a lot of it. I slept through most of it. It was great to be comfortable. I had no pain. Nobody in my world could believe it, not my children, not my sister, my coworkers. Nobody could believe how well this went, and especially me. It was hard to convince people I had actually been to a dentist and had so much work done.
What was it like the evening after your first visit, Gwendolyn?
After my sleep appointment, I didn't have any pain. I didn't feel anything. And I just took the Tylenol that was given to me and the other medication, and I felt pretty good.
I just don't remember any pain. You're going to come out on top, and that's just putting it mildly.
After the visits, when you were sedated, did you remember much?
Well, I remember the first treatment, I took that little pill, and on the way here, I kept saying to myself, this pill isn't working. I'm still awake. This pill isn't working. But by the time my husband drove into the parking lot and I had to get out of the car, my legs were like lead. And by the time he walked me from the parking lot to the front door, I was ready to go to sleep. And so when you think it's not working, it's working.
Chris, how about afterward, after the sedation? Did you remember much?
Not much, no, because I slept through most of it. I was very comfortable. I had absolutely no discomfort. Nobody could believe how easy this went. I couldn't believe it. But my children, my sister, my coworkers, nobody believed it. My particular memory is very, very little. I got up and I ate when I was told to eat. I took the medication that I was told to take. But honestly, I just curled up in my own little bed and had the best night's sleep I had had in years. So for me, it's not anything to remember.
Pat, what was it like for you?
Oh, a little tired, groggy, but no, I even went to work the next day. Everybody at work couldn't believe I was at work the next day. And I was fine.
Chris, what have your dental experiences been like since sedation dentistry?
Well, now it's like being, an apostle. You go out, you tell the good news. You tell people, look, don't do this, do this. This is the way to have things done. Don't let it go. Don't be afraid. You're out discipling people in good dental hygiene. And people were surprised because you never talked about this before.
Gwendolyn?
Now I feel comfortable and I feel confident.
Chris, how did the dental team treat you when you came in for your first appointment?
Respect, exactly, that's the word. I was just absolutely fear-ridden, and I was embarrassed at being so fear-ridden. And that's one of the things that doesn't happen to me here. I am not treated as if being so afraid is a mark against you in society. It's not a bad thing to be afraid. That's one thing that you don't get here. You get, hey, let's make it comfortable for you. And that's what I needed. Well, the team here was so coordinated and so nice that at first you're like startled because this is not an approach that you get in most professional situations. I'm sorry to say, in my doctor's office, I couldn't get anything this nice. So the first experience is kind of, wow, wait a minute, what is happening here? You're not used to being treated this way. Not in this world, you're not. And not when you're so scared you're shivering in your shoes.
Edna?
Whoa. My confidence is up. I feel good about myself. I've fallen in love with the dental staff. So coming here is like, hi, guys, I'm back again.
What would you like to share with someone else who might be considering sedation dentistry?
To everyone that has any apprehension at all, why let apprehension become fear? It makes no sense. I hope that I'm sharing this with somebody younger than me, because the one thing I like to share with everybody is, Your own teeth, your real teeth, are wonderful things. And when you neglect them, the chance of losing them is great. And it's, wow, what I've experienced has been good. It would have been nice if I'd have done this younger, and I wish I had done this years sooner.
Edna, would you recommend sedation dentistry to other people like you?
Oh, yes. Most definitely. Most definitely.
Would you recommend sedation dentistry to other people like you, Gwendolyn?
Yes, I would, because I feel very confident myself, and I would share with someone else who was interested in having work done on their mouth.
How has sedation dentistry changed your life?
I do a lot of smiling. I talk to people much more, and I'm pretty comfortable. I feel very comfortable, greeting people and talking to people and smiling and eating in front of others. I don't have a problem with that anymore.
Well, it certainly changed the way I approach going to the dentist. I have no intention of letting anything happen to the remainder of my teeth because I know that I'm not going to be so fear-ridden I can barely walk, because now I know there's an alternative to needles and drills and things that were so frightening to me. There's an alternative. There's no fear, and there's no reason to be afraid.
Thank you all so much for sharing your experiences. Sedation dentistry sounds like the answer to so many people's problems. It's safe and it works. Trust me, I know. Now people don't have to be afraid of going to the dentist anymore. Now I totally understand how people can literally wake up to a beautiful new smile.
In our dental practice, we believe in making every effort so that your dentistry is done in the most comfortable manner possible. For many patients, this means offering sedation dentistry. You wouldn't think about getting your tonsils out or your wisdom teeth out without sedation, or an operation on your nose or ear, or laser eye surgery, or for that matter, almost any other surgery. Why should dental treatment be any different? Why shouldn't you have your dentistry done in the most comfortable and safe way possible? In our practice, we will make every effort to make your dentistry a very pleasant and comfortable experience with sedation dentistry. For many people who have been avoiding going to the dentist for years, sedation dentistry is the answer to their prayers. Probably the last question you might have is, what if I'm not a candidate for sedation dentistry? Or I decide I don't want sedation dentistry. Can I still be treated in your practice? The answer is most certainly yes. Many patients we treat come to us for general dentistry without sedation. They come to us based on our reputation because they know we'll take special care of them by making their dentistry as gentle and pleasant an experience as possible. You know, there are probably many other questions you have that I haven't answered in this tape. When you come in for your first visit, I want to make sure that you are totally comfortable with me, with the concept of sedation dentistry, and with our office before you schedule an actual treatment. So please write down any questions that you may have so that I am sure to answer them at our first meeting, okay? So let me close by saying I invite you to schedule an appointment to meet our team. When you come in, we'll determine if sedation dentistry is appropriate for you. It is for most people. We'll answer your questions. We'll go over any financial considerations to allow you to fit the dentistry you choose into your budget, and from there we can schedule your appointment for sedation dentistry. We feel our office is a special place for people just like you to be cared for in total comfort and respect.
All right, you put it off long enough. Don't delay any longer. Pick up the phone and call Dr. Tim Modak at 301-884-2299. Remember, he'll treat you with respect. That's 301-884-2299. Or on the web, visit mechanicsvilledds.com. Call today, and then you too can wake up to a new smile.